Hi, this is Catherine Raker of Let's Just Talk. You know, March is Colorectal Cancer Awareness Month. Our guest today is Rajesh Keswani, MD, MS, Associate Professor of Medicine, Gastroenterology, and Hepatology, the Medical Director of Quality for the Northwestern Medicine Digestive Health Center. And, you know, it's so important to be screened. And there's so many things that can happen if you don't get screened. So it's important to undergo a simple test, a colonoscopy or whatever. And I have him here today to talk about screening trends, signs and symptoms, diagnosis and treatments. Good morning, doctor. How are you today?
I'm very well, and thank you for having me today to talk about this.
It's such an important subject, doctor. Let's talk about why I should go and get a screening to start off with.
So I think I think the real thing you already touched upon, which is that colon cancer is unfortunately quite a common cancer. It's the second leading common cause of cancer death in men and women. But on the flip side, it is a largely preventable cancer through the use of a high-quality screening. And so it's important to understand that it's common, but we can prevent it. And that's what, you are providing to your listeners, information on how to get screened and how to prevent colon cancer is very important. There's a lot of options that you've alluded to already, one being colonoscopy, which can actually detect these polyps before they can turn into cancer, to prevent cancer altogether. And then there's stool-based testing, which can actually detect early cancer and hopefully prevent death from colon cancer.
You know, I have to share my story because I had polyps. I was living in Singapore when I had it, and they got it, and I haven't done it as often as they asked me to do it, and it's kept colon cancer away, hopefully, from me. So let's talk about the difference, doctor, between the stool test and the actual colonoscopy, because there's been a real push this in the last, I'd say, 3 weeks about the stool test. Why should, and especially if you have colon cancer in your family, when is it not? When can you have the test done? Do you have to wait until you're 50, or should you have it done before that?
All such good questions. I think there's a couple of things we got to unpack from that. One is that extremely important to know your family history. And so we have general recommendations for average risk population, which is to start colonoscopy or other colon cancer screening at age 45 or 50, depending on the guidelines you follow. But if you have a family member who's had colon cancer, that's a first degree relative, we generally start at age 40 or 10 years before that person developed colon cancer. So that's important to know your own family history and relay that to your primary care provider. And then you have to decide which sort of testing you want to perform. For the average risk patient, both tests are an option, colonoscopy and the stool-based test. What I tell my patients is if you're willing to get either test, colonoscopy is the best test to prevent colon cancer, whereas stool-based tests are good at detecting colon cancer when it's at an earlier stage. And so patients who are willing to get it both, we generally advocate for colonoscopy. However, if you have a high risk patient who has a family history of colon cancer or a history of polyps themselves, really the best option is colonoscopy, and then we generally try to avoid stool-based testing in those patients.
If I'm getting a colonoscopy, what questions should I ask my physician, and how do I know I'm getting the highest quality colonoscopy?
Also a very important question. All colonoscopies are not made equal, and so it's important to understand that your gastroenterologist or a colonoscopist who's performing the procedure is committed to a high quality exam, and we can usually figure that out just by asking them some basic questions, such as how often do they find precancerous polyps in their average risk patients. A high quality exam should find polyps in about a quarter of the patients who get those colonoscopies. If your doctor doesn't know how often they find polyps, or doesn't know how often they get a complete colonoscopy exam, that's not the kind of commitment we want to see in terms of a high quality exam. And so simply asking those questions can open the discussion, and you'll get a sense of how committed that physician is to a high-quality colonoscopy.
One of the questions I have that's not on here is that I remember when I had my first colonoscopy, they gave you a choice of sleep, being not awake, or in some sort of a twilight situation. What's personally now I go under, I can't handle just because I woke up during the procedure. So, is there a better way to do it? Is being out of it, because it's not that long of a procedure. Am I correct?
Correct. The procedure is about a half hour, and there's really 3 ways to approach the procedure. One, which many of my colleagues do, and some of these people who don't want to take a day off of work do, is actually to do no sedation at all. Because colonoscopy, when performed well, in general is not a very uncomfortable procedure, but that's the minority of people. The majority of people will get some sort of sedation, either what people call twilight, or a deeper sedation that's administered by an anesthesiologist. Most patients just need a twilight sedation, which is a dose of a sedative and a pain medicine, and they go about their day after that just trying to avoid alcohol and driving. The patients who really have difficulty with the sedation in the past generally require an anesthesiologist to help provide sedation during the procedure.
And when should screening for colorectal cancers, we've already said begin in patients, what signs and symptoms of colorectal cancer should prompt our listeners to see a doctor?
Yeah, while we recommend in general average risk people getting a colonoscopy at age 45 or 50, even if you've been screened or if you're younger than screening age, if you're starting to have new symptoms such as blood in the stool or change in your bowels where you feel like your stools are not the same as they used to be, or pain in the abdomen that's significant, these are things that make you want to go talk to your primary provider or your gastroenterologist and say, I know I've been screened or I know I'm young, but do I need to get a colonoscopy or some other test? Because we are seeing an increase in colon cancer in younger people, younger than the age of 45.
Is there a reason for that, doctor?
It's a lot of speculation right now. We think a lot of it has to do with changes in our diet. We increased reliance on processed foods, perhaps more sedentary or less exercise. But it's not fully clear yet, but it has really highlighted to us as gastroenterologists that we can't be dismissive of symptoms such as rectal bleeding in a younger population and simply attribute it to things like hemorrhoids, that we need to make sure that we're not missing something more serious like an early colon cancer.
Mm-hmm. How fast can you tell, doctor, if someone has colorectal cancer during the colonoscopy or afterwards?
In general, I'm able to reassure nearly all the patients right after the colonoscopy that even if I removed a polyp, that there is no evidence of colon cancer. And so it's the rare case where we're not sure if a polyp removed was cancer or not. But by and large, most polyps we can tell right away. And unfortunately, if something does look like a cancer during the colonoscopy, I'm able to tell the patient right afterwards and arrange for the next steps in treatment right away.
What treatment options exist for people with colorectal cancer, especially stage 4?
Right, and so we were lucky that there have been a lot of advances in colon cancer treatment, especially compared to some of the other cancers that we've gotten less useful treatments over the last decade. But chemotherapy, surgery, and then interventional radiology based approaches to treating cancer, even when it goes to the liver or other parts of the body, have really been quite effective. And so we're really fortunate that even in advanced stage like stage 4, we have a lot of effective therapies to hopefully create long-term survival in that patient population. So it's not just about preventing colon cancer, but there's a lot of effort to treating even advanced colon cancer.
So that's extremely encouraging, and there's so many new treatments today. Can you tell us, doctor, where can listeners go for more information about this extremely important subject and test?
So we'd encourage people to visit us on our website at dhc.nm.org, where we have a lot of patient-facing information on how they can prevent colon cancer and get screened.
Thank you so much for your service, doctor, and what you're doing for people. Thank you so much.
Thank you for having me today.
We'll be right back after this. Thank you. And we'll be right back after these important messages. Thank you.